The strongest voice in support of Consult Med has been the administrative staff and our clinical staff, who say it's much more efficient. Less of their time is spent chasing bits of paper around and more time spent with the patient. Here at the children's hospitals, we've traditionally had the referral system similar to elsewhere around the state, of phone calls, faxes, letters, and it's a fairly slow process going through those. It's also hard to keep track of the bits of paper, and it's always hard to tell where a referral is up to, both for the clinician looking after them, for the paediatrician or GP who's referred them, and also for the family who don't quite know where they're up to with their referral. First I heard about Consult Med was from clinicians who told me that it was a great idea and they'd tried it and it really worked for them. What it's done is completely revolutionised the way they deal with referrals. The referrals are clearly identified when they arrive electronically, they're seen fairly swiftly, they can easily be organised in a much shorter time frame, and everybody can keep track of where the referral is up to. One of the interesting things that clinicians are concerned about is the right patient getting to the right clinic, and Consult Med gives you the opportunity to provide that feedback at the time when the clinician is referring the patient. So a clinic can set up parameters about what type of patients are best treated there, and so the referrer knows they're setting the right type of patients into that clinic, which is very valuable. I think one of the things that sets Consult Med apart is that it's been designed by clinicians, but also then multiple clinicians have had input into its development, which means that it works in multiple different environments. I think it will be quite a significant game changer across all of public health care, where you're seeing clinical teams coming forward saying, please include us, and getting onto the system. They're often very different clinics, but there is capacity to customise it, so it suits different clinics. And I would suggest that it's easy to implement, and it's been working really well for us at Sydney Children's Hospital Network.